Welcome to City Week, ladies and gentlemen. I am your host, Alton West. Today I will have guests on from West Georgia Health and also from LaGrange Hospice. So make sure that you stay tuned for those interviews in just a moment. Today my guests are from West Georgia Health. I have the Director of Oncology Services. I have Charlene McCallahan, and also a Cancer Care Navigator, Wanda Lowe. Wanda, welcome, and Charlene, welcome to the show.
Thank you.
Well, ladies, we're here today to talk a little bit about something that most of us men probably would push aside, but it's so important, so vital to our health and longevity as far as life is concerned. We're talking a little bit about Scope It Out. Charlene, talk a little bit of what is Scope It Out? What are we talking about here?
Okay. Well, March is Colon Cancer Awareness Month. So we're here today to try to make sure that everybody understands how important it is to have your screenings for colon cancer, because even though colon cancer is the third leading cancer, it's the cancer that is so preventable, because the screening, which is the scope that we're talking about here, many times can alleviate the little polyps that are either precancerous, so you get them early and you don't have any signs of cancer, or you get them at an early stage even if they are cancerous, and the treatment is much easier on you and your survival rate's much higher. So it's really, really important to be screened. And certainly if you're age 50 and over, and that's for male and female, because our biggest population group now in the United States are the baby boomers. So we've got a big population there that's hitting that age, and age is a big factor in forming cancerous lesions. So everybody that's that age and older certainly needs the colonoscopy, and it's about every 10 years. You don't have to do it often.
Right.
And but if you have had any family history, if you've had any cancer in your family, or irritable bowel syndrome, Crohn's disease, anything that has been a big abdominal disease that you've had, you might need more frequent checking than 10, maybe every 5 years, but your physician can help you with that if that's true. But these are just all points that are so very important because it is so preventable if we do that. So the hospital has started a campaign this month called Scope It Out. And of course, that is alluding to the scope that we use, right. But vitally important that you do. And even though it's not a fun thing to think about doing, it's quick, it's easy, it's over, and then you've given yourself a whole lot more years of life.
Absolutely.
So it's very important.
I want to come back to a point you made in just a moment ago about it being the third leading cause. But before we do that, I want to jump over to Wanda just a second, because one, I know that for you, this is something that's also very near and dear to your heart. Talk a little bit about your role as a cancer care navigator, and why are you here to talk about Scope It Out as well?
As the cancer care navigator, I get connected with people when they have a diagnosis of cancer and try to get them navigated through the journey of cancer with resources, information, support, whatever it is they need. And many times with people with colon cancer, after surgery, they may have a colostomy that they need help learning how to manage that, help with supplies and things like that. I think it's so near and dear to my heart because early on as a nurse, listening to physicians talk about the importance of this screening, because this can be a preventable screening for this kind of cancer, it just makes me wonder why more people don't do it. I know the cost of a colonoscopy is one thing, but you know, I find that in the healthcare environment, we find ways to help people, and that's what we're all about, is trying to help people get what they need. In Troup County, we have, unfortunately, a lot of our patients that we diagnose with colon cancer, more than 60% of them are diagnosed at a later stage. And we don't see a good outcome, as good an outcome as we would if we would have found that cancer at an early stage, or if we would have gotten that polyp before it turned into cancer. So it's very difficult when you work with people, and you know, you feel like maybe we could have prevented them to get to this point if they would have done the screenings, or they would have gone with symptoms. You know, there are symptoms of colon cancer. There aren't when it's early and there's a polyp that needs to come out. You don't know there's a polyp there unless it is scoped out and you find it and you take it out. But if there are colon cancers developing, there are some signs that people need to pay attention to and need to get help for, such as bleeding. A lot of times people will say, well, I have hemorrhoids, so, you know, the bleeding's related to that. Well, it may be, but, you know, it may not be. You need to pay close attention, and you need to know and understand what might be a hemorrhoid problem or what might need further investigation. Changes in bowel habits, you know, a lot of times, if you've changed your diet, yeah, your bowel habit may change, but being very tuned in to what's happening with your body and paying attention to what comes out of your body, you know, that's important to do that, because when things change, that can be a sign. Another sign of colon cancer is you know, abdominal pain or cramping or a feeling that you need to have a bowel movement, and when you go and have one, it's not relieved. Things like that can mean there may be a cancer there that's obstructing your colon and allowing you not to have proper bowel movement. And when people ignore those signs and they rock on for a period of time, and then when they get diagnosed, it's a later stage, and colon cancer can spread to the liver, and you know, that's not a good thing. And you know, we want to help people at the earliest point we can and get the best outcome for them and the best quality of life we can.
Very good. You know, one of so many wonderful things that you said. You know, you're talking about, you jumped right into my second question to talking about the symptoms of it. And you know, I think sometimes, I was talking about us men want to push that aside. We sometimes, oh, I'll be fine in a few days or whatever the case may be. But you, Charlene, you were saying that colon cancer is the third leading cause of death here in our community. Why do you think that's so?
Well, I think part of it is some of the things Wanda's just alluded to. We just don't go and do our screenings. We don't have symptoms. We're okay, so we don't go and do it. But it's one of those things that you just really, as women go and have their annual mammograms, men go and are tested for prostate cancer, everybody needs to adhere to these screening guidelines for colon cancer. And
it's so important too. And I think that you all at West Georgia Health are doing a campaign. You're launching a campaign, you said, and I think there's going to be some mail outs. Talk about that for us.
We plan to do a mail out. You'll probably be getting one in your home, and it's just to tell you about the symptoms, tell you about the risk factors, and tell you about that we would be happy to come if you have a group, any particular group, a church group or civic group that you would like for us to come and give a little talk to and tell some of the things we've talked about this morning and explain a little further about colon cancer. We'd be happy to do so, and if you do so, everybody that's a part of that group will have their name put in a drawing, and we'll draw for 3 free colonoscopies. We'll have the drawing on May 6th. And we would let you know the winners at that time. We won't announce a winner due to HIPAA guidelines, but we'll call you and let you know if you did.
All right, well, very good.
Because we believe it's that important.
It is, you know, and one you were mentioning in your conversation there about polyps and you know, some of the symptoms and the treatment there. Kind of help people to understand what a polyp is, if you don't mind.
A polyp is a growth inside the colon that just sort of, sometimes it looks like a mushroom that pops out and may have a little head to it like a mushroom, but it can come out from the inside lining of the colon. And it can, you know, small polyps can be there and not really cause you any problem or any symptoms or anything. Sometimes as they grow older and have been there a while, bleeding might occur from them, but again, they turn into cancers. And that's why if we go in and we see you have a polyp, the doctor takes the polyp out, it goes to pathology, we look at it, and if it's fine, then great. If there's some cancer cells there, then, you know, we've found a cancer early to do something about it. The other thing about a polyp is, I mean, again, you just don't know that they're there necessarily.
Kind of undetectable until you see something happening out of the normal, right?
And if they're found, then the screening guidelines change for you. You need that colonoscopy every 5 years, because we need to go in there. The doctor wants to go in there at 5 years and look to see. You may be someone who has something called familial polyposis, where you get more polyps than anybody else, but it means they need to be checked out.
Okay, all right. And you know, it's so important. Now, let me ask you, I heard you mentioning too about diet. What can individuals do to help themselves to, you know, avoid risk of polyp growth and things of that nature? What can some of the things they can do to change their diet, Charlene?
Well, of course, some of it is going to be genetic, and you can't do a whole lot about it, but most of us can watch what we eat Eat high fiber. You mentioned that when you went, that they told you needed more fiber in your diet because that helps cleanse your colon more. Can exercise. There have been studies everywhere showing how really medial exercise, 3 times a week, 30 minutes, can make a big difference in increasing your survival rates from cancer, whether you have had it and you're in remission or whether you're working on preventing it. So those are definitely things. High alcohol consumption, you need to cut down on that. Of course, long-term smoking, need to cut down on that. So those are just routine things that we can all do that would be very helpful. Decrease the amount of red meat in our diet, those type
and processed
things.
meats.
Okay.
We sometimes don't think enough about that.
Yeah,
processed meats are things like hot dogs, sausages.
Well, you hurt me now, one.
I know, I'm sorry, everybody loves a good hot dog, and we have some of the best I know in town, but hot dogs are high processed meat that, there are a lot of things in there that can be carcinogenic, meaning they can potentially cause cancer. So if your diet is such that you eat a lot of sandwich meat, hot dogs, red meat, sausage, those kind of processed meats and red meats, then that's a risk factor you can modify. That doesn't mean you never can have that, but that just means that it shouldn't be the top thing in your diet.
In moderation.
Everything's in moderation. That's
Absolutely.
Exactly right.
Absolutely.
Yes.
Now, one you made, as we get ready to close out, you made a mention a moment ago about 60% of the cases that you see are in the latter stage. What do we want to do, ladies, to get that number down?
Well, we really want to get people out there to do the screenings. That's the biggest thing. And to look at what they're, look at these modifiable risk factors. When West Georgia Health participated in a community health needs assessment, that really got us some nice data about where the problems are in our community health-wise. And in terms of colorectal cancer, we found that Troup County does have a higher rate than the state of Georgia. And we found the highest rate of those people with colon cancer are black females. So we really want that population to pay attention to any modifiable risk factors, to talk with their doctors about any changes in their bowel habits or any concerns, and to get those colonoscopies done.
Well, very good.
And again, Charlene and I make ourselves available to the community to come to a group. If you get a group of 15 people or more, we'll come, and everybody there, their name will go in the drawing for perhaps a free colonoscopy, which could help a lot.
Well, very good. Charlene, as we close out, give them contact information if anybody would like to get more information.
Absolutely. It's 706-845 and it's 3600. It's the number they can call, and we can set up something to come out and talk with your group. Or you can email scopeitout at wghealth.org.
Okay. Well, ladies, very good show. Thank you all for coming in, and I hope that people will take heed to the message that you all are sending, and definitely get those mail outs and get them back in to you all so we can help people scope it out.
Thank you very much.
Thank you, ladies, so very much for coming on the show today.
Thank you.
All right. Ladies and gentlemen, stay tuned. We're back from More City Week in just a moment.
Hey, we're here today with Al Brannon at Marketplace on Lafayette Square. And Al, you're getting ready to celebrate your 1-year anniversary in this location, aren't you?
Coming up May 5th, on a Sunday afternoon, we're going to have our 1-year anniversary celebration from 3 to 5.
That's wonderful.
So we'll be doing lots of refreshments and lots of sales. The week before and the week after, we'll be running specials throughout the shop.
Great. Now, for the viewers that haven't had a chance to come into your shop yet, would you explain to them a little bit about what you've got here, what type of merchandise you've got at the marketplace?
Well, we're a shop that's full of lots of antiques, period antiques, newer items, lamps, art, jewelry, home decor, new, old, a large variety of something for every age bracket to come in and shop.
And the exciting thing about coming into the marketplace is every time I come in, there's new and different merchandise, so you never really know what to expect when you come in.
We have new merchandise that arrives daily.
Oh, really?
I have 18 different dealers that reside in the shop, and then I have about 45 different consignment people that consign with me that bring stuff in daily basis, weekly. So stuff is always coming and always changing.
Oh, that's wonderful. Now, can you explain a little bit about the consignment items? Do people just bring in 1 or 2 things, or? How does that work?
People bring in, they send me photographs of things that they're looking to sell, and then I approve what they have in their house or what they want to sell. And we bring it in. It could be one item, it could be 4 or 5 items.
Okay.
And we keep it for 90 days.
Do you have a special location in the store that you hold those items, or do you just fit them in amongst?
We fit them in amongst the upstairs as well as the downstairs
Okay,
level
okay.
of the shop.
And Al, as I look around inside the marketplace, I see so many different types of merchandise. Let's talk about some of the things that maybe unexpected things people could find when they come in, and also some of the new things that you've offered since you've opened here.
We have lots and lots of wonderful period antiques, furniture that's 50 years old, 100 years old, and porcelains and pieces that sometimes are 200 years old. And we're selling them. People are realizing a good investment they have in these pieces. And we've also have gotten in over 100 Oriental rugs.
I noticed that. We're
and-
standing on some of them. So.
And they're selling right well. They're good quality, handmade Oriental rugs from Iran.
And you have all different sizes too. I noticed you have some runners and some smaller rugs, and then downstairs I also noticed you have good size area rugs.
Yeah, we have every size you could think about, and if we don't have the size in the shop, we can get it for you. We have a source to get them. So
Oh, that's great.
we're here to meet everybody's needs.
That is
We
wonderful.
want to give them customer service from the front door to all the way through the shop and back out.
That's
So,
great. Well, thanks again for letting us come in and visit today. And it's always a treat to see what you've got in store at the marketplace.
Thank you.
Welcome back to City Week, ladies and gentlemen. Now my guest is from Hospice LaGrange. I have the Executive Director, Kathy Wiggins. Kathy, welcome to the show.
Good morning, Alton.
Well,
Thank you.
Well, it's a pleasure to sit down with you again and talk about Hospice LaGrange. And I know there's some of the times when you hear Hospice LaGrange, people, I guess, ultimately think about the ending of things. But I know that you're here to talk a bit about things that you guys can provide prior to that. But first of all, talk a little bit about what your role is there.
Okay. Well, I'm the director at West Georgia Hospice. I am a registered nurse, but I serve in the function of as the director right now. I haven't been hands-on nursing in a while, although I can answer a lot of questions about our care. I make sure from day to day that all of our patients are cared for, that we're meeting all the regulations from our Medicare and Medicaid providers and our Medicare and Medicaid reimbursement sources, that we meet state rules and regulations in our Joint Commission. We are Joint Commission accredited, which means we're even at a higher level of standards that we meet on a day-to-day basis. Make sure that we have the staffing that we need and that all the services that we have are being provided to our patients. So that's one of the things that that we're very intent on letting people know about. People think of us only as Hospice LaGrange in our building and that our hospice house. That's wonderful, and we're so glad to have it. But we do so much more. To become a hospice member, you have to have a statistical prognosis of 6 months or less if your illness runs its natural course. And this is 210 days, and our average length of stay is only about 49 days, which means that we could be serving people much sooner than we actually are. And a lot of times the doctor will refer the patient to our program, but then the family or the patient say, well, I'm not ready for that yet. And what I'm trying so hard to do is to try to remove that fear of the word hospice, because we have so many services that we can provide to help that patient at home. An example is one of the things that becomes difficult when you have an illness that requires a lot of medications is that a lot of your time is spent just checking on your prescriptions and making sure they're refilled and going back and picking them up and calling the doctor and all those things. We do all of that for you, and the medications are delivered directly to your home. They're actually FedExed to your front door, so you don't even have to go pick up your medicines anymore. So you could spend that time with your family or going to church or doing something that you really wanted to be doing. We also help people if they're physically able, and the earlier we get them on our program, the more physically able they are to do things like go on a trip. And we can actually do a subcontract with a hospice in another state, so that if, let's say, one of your family members, Alton, was on our program and they wanted to go to South Florida to see a family member. We could arrange with a hospice down there so that if the patient got in any kind of trouble, got in any kind of symptom management crisis or anything, that they would call us first, and if we could not help them by phone, we would have arrangements with the hospice down there to make a visit even to their hotel.
Oh my.
To see them, so that they didn't have to go to an emergency room in a town where they didn't know anyone.
Oh my goodness.
So there are just so many things that we can do to help the quality of life. That person might not have felt comfortable traveling without that support, where we can make those arrangements and have them be comfortable to travel.
Let me ask you a question, because you mentioned a lot of great things there, and we're talking about the home care. This is the home health care that you're talking about
home
here.
hospice.
That's right.
Home health is a different department. That's for people who are rehabilitating in their disease process. Under hospice, it's when you're not going to take any more curative treatment.
Okay.
In other words, you're not going to be taking chemotherapy for a cure. You're not going to be going in and out of the hospital for curative treatment for another disease process. It's when you've said, or when the doctors have said, we don't have any more curative treatment, then there's so much more our hospice program and our staff can do to help that person have a great quality of life. Otherwise, you're sort of struggling with those things on your own. We have people that if they're not on hospice, they may not have another doctor's appointment for 2 or 3 months, but they may have some pain, or they may have some other symptoms, shortness of breath or whatever, and they say, well, I don't want to bother the doctor. I've got an appointment in 8 weeks or 10 weeks or whatever. They can call their nurse that day, and that nurse will call the doctor for them and get the resources, the medication, the treatment or whatever that they need to feel better and to feel more comfortable. So they're not wasting those precious days,
Absolutely.
in suffering.
Right. And you mentioned about a nurse. So if someone is on the home, then they have an assigned nurse to them?
They have an assigned nurse that comes every week and more often if needed. We had a patient recently who wanted to be at home, and he was on a medication that required the nurse come in 3 times a day to change a pain pump, that he was getting the pain medication directly into his vein. And she came out 3 times a day to change that. One of those times was 1 o'clock in the morning. But that patient wanted to be at home. And we were able to serve him for several months at home. Had he waited, he would have either been in the hospital for some of that or been in very serious pain and may have even died much sooner than he did. So a lot of times the things that we're able to do actually, without them being curative treatment, actually prolong the life because of the comfort measures that we're able to provide.
Well, very good. Let me ask you, you mentioned a moment in your conversation there, Kathy, about the doctor made the referral and the family, for some odd reason, decided not. What do you feel like is the biggest reason for them not?
I think when people hear the word hospice, they think that means I'm going to die, and I'm going to die very quickly. And I think some of that reputation comes from the fact that a lot of times when people are referred, they've been in the hospital many times, and they may be referred very late, and the patient moves over to Hospice LaGrange from the hospital and actually dies sometimes within 24 hours, sometimes within a week, sometimes 2 or 3 weeks. But I think that's what people think, that, okay, if I hear that word, that means I'm about to die. And what we're trying to help people understand is that if hospice is suggested to you or your family member and you're still up and about and doing well, if someone could just not say, I'm not ready for that yet, and give us an opportunity to let them know what things we could do for them to make their life so much easier early on. And it may be that our social worker only comes once a month to see you just to make sure there are no changes or anything that you need. The nurse may only come once a week to say, okay, do you have all the meds that you need? Let's make sure your refills are ready. Are there any new symptoms that I need to check on for you and help you with? It may be their birthday, and we take them a birthday cake and help them celebrate, because the family may be very exhausted and not able to make that celebration happen. We've helped people celebrate their anniversaries with big parties and champagne and dancing and whatever needed to be done, because the family's so tired they can't do those things for that person. But if we're not allowed to help
that's
them,
right.
these things don't get to happen. And that's what we want to take the fear out of the word. Because actually, if someone is referred to hospice, that means their prognosis is not good. And with or without us, the disease is going to progress. But if it can progress with us, we can make their life so much more comfortable and give so much support to that caregiver. I really, really believe this.
And I can tell you do. Now let me, because you were talking, you were talking about the caregiver and you're, making sure the meds are filled. Talk a little bit about your staff, because I know that you have a wonderful team.
We do.
Talk about your staff.
I can't say enough about my staff. I have such dedicated nurses and social workers. We have 2 chaplains that also serve as a bereavement coordinator, which means that after the death of the loved one, these chaplains are going to come visit them usually within a week and then periodically throughout that next year. My social workers are licensed master level social workers. They have counseling skills. And you and your family may not need that, but you also may be a young mother or a young father that's worried about what's going to happen to your family and your children after you're gone. And if we can come in there early enough, we can help you with those plans and those arrangements so that you don't have to worry about that anymore, and you can go on enjoying your family while you have time with them. Our nurses are incredible. Our registered nurses, most of them have been with me with our program. I say with me because I feel like they're mine. It is. That they've been there for years, many of them, and we do in-service education to keep up on the latest and greatest pain and symptom management methods and the new treatments and medicines that are out there for comfort. We stay on top of those. Dr. Larry Ginther is our medical director. He is a medical oncologist, but he also is an internist, and so he is up on all kinds of diseases, and he is a wonderful resource for us when we don't know, or have questions about what to do. He also visits at the Hospice LaGrange at least 2 times a week and sometimes more often, and so I just can't say enough about our care. We have wonderful certified nursing assistants, and they are certified by the state of Georgia, which means they have competencies that they have to meet. They go in the home, and we get such wonderful accolades on them. And they go so much farther than helping with a bath or a shower in becoming a family member with our families, and trustworthy and just incredibly kind. And then at Hospice LaGrange, we have the same chaplains and social workers would follow you if you had to go to Hospice LaGrange for symptom management, or it became closer to the end and your family couldn't manage and we brought you to Hospice LaGrange. You would see the same social worker and chaplain, which is wonderful.
Right.
And then our nurses can also visit there, and then our nurses that are there and our certified nursing assistants that are there or have the same training, and so we work as a very close team.
And I can, and like I said, I've been to Hospice LaGrange a couple of times, a number of times, and every time I've come in, as I was telling before we came on, the staff is so very professional, so very courteous. And as we get ready to close out, I don't want to mention one thing that's coming up in June. You got a Camp Dogwood. Talk about that real quickly.
Yes, Camp Dogwood. This will be, I believe, our 16th year. It is a grief camp for children ages 6 through middle school, which I believe is about 13 or 14. And it's 2 nights and 3 days. It is free of charge to children, to any child who has had a loss by death in the last year. And they do not have to have been served by our hospice program. It could be, it could have been an accidental death or something like that, or have been on another hospice in another community and they want to come. We serve 5 counties: Harris, Heard, Meriwether, Troup, and Coweta. And so the children can come from any of those counties that we serve. If someone, a teacher that's listening, or counselor, or parent, or grandparent that would like more information, you can either call West Georgia Hospice at 706-845-3905, or you can email campdogwood@wghealth.org. Either way, and we'll respond. We watch those emails every day, and we can send an application to anyone who's interested.
All right. Well, Kathy, I'm going to tell you, I mean, like I say, you and the staff and everyone do an excellent job there. And I know that the community, we're just fortunate to have you, and all of the nurses and doctors there in our community helping us to kind of enjoy those last quality of days that we have left there.
Thank you very much,
And
Alton.
thank you very much for coming on the show today, too.